Hi everybody, Christian Nix here at Mercy Hospital in Chicago, and I want to take just a few moments to talk about and to answer a question that I'm asked almost wherever I go these days, wherever I teach or lecture. What is the difference between hospital-based practice or mainstream practice and private practice or everything else? This is a good and fair question, and it is also, I think, extremely important to have a lot of clarity on this issue during this era of healthcare reform. What you will find is that there most certainly are definite things you can, should, and must do in a hospital setting that will not fit within most private practice settings, and vice versa, that there are things most people do, some of them without conscious consideration, in private practice that will definitely sink the ship if you try to pass them off in a hospital or mainstream setting. But, and here is my first point, whether or not you intend to work in the mainstream, like a hospital or physician group practice, you must understand how and why the game is changing and what you should be doing about it to grow your career. Actually, there is no doubt left but that this movement in mainstream medicine to include professional quality holistic medicine is definitely underway and only going to continue. So the best and brightest of you reading and listening to this should be preparing. But the real question then becomes how? How can I prepare for mainstream practice? Well, here we must return to our original premise, which is what makes hospital-based practice different from all else and why? First of all, it goes without saying that your clinical skills must be outstanding. The very nature of acupuncture and holistic medicine, which is so bizarre and foreign to our North American way of thinking and to the model of science which most people are accustomed to, that not only is word of mouth essential, it becomes doubly so in a hospital-based setting and can be leveraged to explode traffic to your clinic. But less obvious than just having great clinical skills is how you actually apply those skills. In private practice, you can move more or less at a pace that the patient wants to go. In hospital-based practice, the physician must control and dictate the clinical reality in a different and specific manner. In fact, this issue of who really is in charge is the pivot between the two settings. The hospital-based clinician must do what patients in a hospital would expect. The private practice clinician very often must bow to the patient's preference and not do the things that the patient doesn't like for fear of losing business and revenue. The hospital-based clinician does what she knows is best and lets the patient decide whether or not to return. The private practice clinician cannot afford to offend. The hospital-based clinician gets right to the heart of the matter with no preamble and begins treatment after a brief dialogue in which the clinician is directing the conversation. The private practice clinician is often stuck in the role of psychologist and confidant, as many private practice patients want to wax long-winded about irrelevant information simply so they feel heard. The hospital-based clinician needles with deliberate assertiveness and is not concerned if the experience proves an intense one, if that's what is called for by the patient's condition. Here I am certainly not advocating heavy-handed, brutal, or insensitive care. Rather, it is a fact that many patients with chronic functional illness must receive stiff and intense treatment if they are to improve. The comment I hear most often from HBA training students is how aggressive the treatment is or seems to be and how they could never get away with such intense needling in their private practice. But this is flat out untrue. Your practice and reputation as a competent clinician stands to gain far more from doing what needs to be done than from doing watered down treatments that leave patients questioning whether or not acupuncture actually has any effect at all. This may be the most obvious difference between hospital-based practice and private practice. The private practice clinician can talk nonsense, boasting to patients and other medical professionals about esoteric and/or foreign concepts from the holistic model, because it's not really an issue to their livelihood whether or not they will be understood. The hospital-based clinician lives or dies on communication and presentation skills. This is where serious mastery and real career success comes from. Acupuncture is dirt simple and one of the most effective medicines for 21st century adults in North America. Don't complicate it and don't make a big deal about it. That's my advice. If you are great, wear it lightly. Your skills should be no big deal to you. But your communication skills and your ability to present a competent model of holism to conventional medical professionals is the most important skill set you can adopt and develop. This is where the hospital-based professional outshines the private practitioner. The real issue regarding acupuncture's inclusion in the mainstream is not really about whether or not it works. Most physicians and administrators, even the hardest skeptics, are willing to stand down since acupuncture is so commonly in the news media as a pain and stress therapy. But without a professional presentation and the patina of real logic and competence, most of those same physicians and administrators simply cannot bring themselves to embrace the inclusion of holism or acupuncture. Be a professional. Learn to speak, teach, and present like a pro. This is the single most important skill you can adopt to further your career, whether or not you decide to give the mainstream a shot. What do you think will happen to your practice if you fail to embrace the changes and coming reforms in healthcare? How many people will really have 1 hour and $75 to $120 for a private treatment in the economy that is developing in North America in the 21st century? What will your career look like in 2 to 5 years? Hospitals in mainstream settings are all scrambling to reduce costs and increase patient satisfaction in the era of healthcare reform. In 2 to 5 years, inclusion of holism is going to be an established fact in most of the mainstream settings all across North America. If you miss your chance, you will not get another. The era of healthcare reform is well underway, and, whether you realize it or not, as a holistic professional, you are holding some pretty good cards for landing a position that could translate to prestige, excellent income, and real career satisfaction. The whole purpose of the hospital-based acupuncture training program is to prepare you for mainstream success. The hospital-based acupuncture training material is the only curriculum of its kind with a total focus on your success within the mainstream. Your HBA training material is intended to distinguish the essential elements of mainstream practice and give you practice tools and reference material for high-level mainstream success. Give you the tools and insights for cultivation of your professional persona. Highlight and address the essential core competencies of mainstream and hospital-based practice, including ultimate clinical skills, communication skills for presenting and teaching, skills for writing articles for publication, demonstrate administration skills and how to structure your practice. Provide marketing skills for both your clinical practice and your hospital pitch. Congratulations once again for your purchase. This HBA training guide and fast implementation introduction is intended to get you started quickly and keep you on track for mainstream success. Your chances for breaking through to the mainstream have never been better. Mainstream settings are looking for you. But this does not mean that you can sit idle and just think positive thoughts. Breaking through to the mainstream is work, plain and simple. If that is bad news to you, then you're probably in the wrong place. But if you think, so it's only work and this guy is going to show me how, well then, let's get busy. Then I can guarantee you that good things are coming your way. Good luck and work hard.